The purpose of this video is to provide instructions for entering non-Medicaid service or NMS data into MOTS. Entering client profile and behavioral health data is required before MOTS will accept non-Medicaid services. Instructions for entering data in the client profile and behavioral health sections are in other videos, which should be viewed before this one. Please review the MOTS reference manual for information on specific fields in the non-Medicaid service section. This manual and other helpful tools can be found on the MOTS public website. This demonstration will take place in the MOTS training environment, continuing with the randomly generated test client who was entered in the client profile video. For reference, here is the URL for the MOTS training environment and the email address for MOTS support. Remember, when using MOTS training, enter only false test data. Real clients should only be entered in the live production environment. Status updates, including the client profile, behavioral health, and addiction detail screens, are required for all MOTS reportable clients. MOTS reportable clients are those whose services are paid in whole or in part by any public funds or who receive DUII or synthetic opiate treatment. Non-Medicaid service data has different requirements specific to service events. For some clients, no non-Medicaid service data will be submitted. For others, non-Medicaid service data will be submitted for each service event. For others, some service events may be reported while others are not. A detailed explanation is available on the MOTS public website. Ask these questions to determine whether a service should be reported as non-Medicaid service data. Is the procedure funded in whole or in part by Medicaid or the Oregon Health Plan? If the answer is yes, do not submit service data to MOTS. If the answer is no, move on to question 2. Is the procedure part of a DUII or synthetic opiate treatment program? If the answer is yes, service data must be submitted to MOTS. If the answer is no, move on to question 3. Is the procedure funded entirely by the client's insurance or by private payments? If the answer is yes, do not submit service data to MOTS. If the answer is no, service data must be submitted to MOTS. After logging in, the MOTS homepage will display. From here, this demonstration will illustrate entering non-Medicaid services for an existing client. Click the Client Entry tab at the top of the screen. First, find the client. This is the client lookup screen. Always search for a client before entering a new record for him or her. This will help prevent the accidental creation of duplicate records for the same client. Confirm that the agency and facility fields contain the correct selections. Enter all or part of the client's last name, or enter all or part of the client's first name, or client ID, or Medicaid ID. In searching for a client, the less information entered or the broader the search criteria, the better. Simple differences in the spelling of a name may make existing clients difficult to find. Click the Search button. The search results are displayed. When the correct client has been located, click any part of the line containing his or her name and other information. This client has the necessary records for MOTS to allow the entry of non-Medicaid services. It may be useful to take some time to update any information on the existing client profile, behavioral health, or addiction detail screens that may have changed since data was last submitted for this client. When any applicable updates have been submitted, click the Add Non-Medicaid Services button. Fill in the fields as appropriate. Each field on this screen will be described in detail as example data is entered. Select the date of service using the calendar icon or type the date. The date must appear in an 8-digit format. Leave the second date field blank unless entering per diem services under a residential facility. Enter the first part of the description or code. Then select the appropriate code from the resulting list. Select the option that best describes the location in which the service was provided. These fields are optional. They can be used to give more specific information about the selected procedure code. Up to 4 modifiers may be selected for a single procedure code. Indicate the number of units of the service provided. This entry must be whole numbers. Some procedure codes refer to one-time events, so their unit count could be 1. Other procedure codes are measured in increments of time, such as per 15 minutes. If this client received 45 minutes of such a service, the unit count would be 3. This field refers to the organization that is paying for or overseeing the service. In most cases, it will be the context agency. Enter, in whole numbers, the monetary charges associated with this service. This is the total charge for the amount of units entered. For example, 3 units at a rate of $50 per unit result in $150 in billed charges. Do not enter a $sign. Because the list of ICD-10 diagnosis codes is very large, the search criteria in MOTS was separated into 3 categories. The in-use selection shows any diagnosis codes that were selected in current or previous episodes recorded for this client. The behavioral selection searches codes specific to behavioral health issues. The All selection searches the entire list of codes. Select one of the 3 filters. First, enter the diagnosis that this service event is addressing. If the available list is short, such as when using the In-Use filter, simply click in the diagnosis box and make a selection. If using the Behavioral or All filter, begin typing the description or code for the applicable diagnosis. If searching by ICD-10 code, do not enter the decimal point. The diagnosis will auto-populate if the client only had 1 diagnosis in the behavioral health treatment episode. Multiple diagnoses can be selected. The primary diagnosis can be changed. To remove a diagnosis, click the Delete command. If entering a single service event, click Submit. If entering identical service events that occurred on multiple days in a single month, save time by using the Add Additional Dates button. For example, if the client attended group counseling sessions every day for a week, this button allows for the entry of all those services at once. All service data must be the same for each field. If this is true, click the Add Additional Dates button. Select the dates of service and click Submit. When done, click Submit. On most screens in MOTS, clicking the Submit button will cause the client summary page to display, but non-Medicaid service submissions are different. The data entry screen will be redisplayed with blank fields, allowing the opportunity to enter more service information for this client. Near the bottom of the page, previously entered service information is visible. If a service entry needs to be modified, or if a service was entered in error, click its line to edit it. MOTS does not have a delete option for non-Medicaid service data, but changing the number of units and the billed charges fields to 0 will indicate that the service record is to be discarded. Click Submit after making changes. When done, click the Back to Client Summary button. The services are now displayed on the Client Summary screen. This concludes the training video for non-Medicaid service data. To continue learning about entering data into MOTS client entry, please review the next video on mental health crisis events.